First, as Mrs. Kennelly pointed out, the average benefit for a retired worker is about $13,000 a year. That was in just last month. While that's an important amount of income, it's far from a comfortable level of living. And it's also important to know that Social Security is a key part of income, not just for low-income seniors, but up through the middle and the upper middle of the income distribution. The next slide has more details on this. This is showing Social Security as a percent of seniors' total income when seniors are divided into 5 equal groups based on their income. For the lowest income group, and this is couples and unmarried individuals together, the lowest income group, their income is less than $12,000 a year. Social Security is 82% of the total. For the next to lowest income group, their income goes up to almost $19,000 a year. Social Security is still almost as large a share, 79% of their total income. You get to the middle income group. That is those with incomes between roughly $19,000 and $29,000 a year. Social Security is 2/3 of that. You get to the upper middle income group with incomes between $29,000 and $50,000. Social Security is still the largest single source of income. It's nearly half, 45%. Only when we get to the top income group with incomes over $50,000 a year is Social Security not the main source. And it's important to know why it's not the main source. Most people in this top income group are still working. They're not retired yet. And earnings from work are their largest single source of income. So to the extent when and if they do retire, their income will be probably at a different level, at a lower level than it currently is. Moving on. And other reasons we talked about the need to focus on adequacy is that, as Henry pointed out, replacement rates are modest. They're modest by international standards. And they're modest in terms of thinking in terms of how retirement advisors talk about retirement income adequacy. Today, a 65-year-old receives about 39% of prior earnings after taking out Medicare premiums. That's for an average earner. But under current law, that will decline to about 32% for those retiring in 2030. And that happens for the 2 reasons that Henry Aaron talked about, that replacement rates will go down because the age for receiving full benefits is rising, and because Medicare premiums are taking out a bigger bite of of Social Security benefits. So benefits are relatively modest today, but comparing ourselves to where we've been over the last 25 years, replacement rates will not be that good in the future. Okay, the next reason why it's important to think about adequacy, and this is not about Social Security, it's about everything else. All the other sources that people can count on in retirement are taking a hit in the financial crisis. The value of people's own homes are at risk. 401k plans are declining in value, and employers have often taken a holiday from putting money into 401k plans because the employers themselves are at risk. Pensions are being frozen by employers or terminated. Savings accounts are subject to the same uncertainty as 401k plans. And jobs, that chance of having a retirement job, is also much riskier in today's economic environment. So in this climate of uncertainty, only Social Security has been able to hold its value for seniors. So that poses the question for us of just how big should this foundational piece of retirement security be? In terms of how we might improve adequacy, I'm talking about options here that have been suggested. These are not firm recommendations, and we don't have cost estimates for them here, but they're ideas that have come up in various venues, including a recent project of the National Academy of Social Insurance, where we were asked to invite scholars to come up with suggestions for improving Social Security for vulnerable groups. One of those was to create a special minimum benefit that guarantees a meaningful standard of adequacy for people who have long work records under Social Security, say 30 years or more. Another innovative proposal is to improve benefits for widowed spouses of low-earning dual-earner couples. Social Security now does a pretty good job of easing the transition from couple to widowhood for couples in which one was a primary earner and one was a secondary earner. But for couples in which both were almost equal earners, the benefits are not as adequate for the survivor, but there are ways to improve that if we wanted to do so. A third kind of change that people have talked about was very kind of simple, but simply ratchet up benefits after a certain age, say 85. Because people beyond a certain age, these other sources of income are much less secure. Savings may have been depleted or spent on a spouse's final illness. Pensions, for those lucky enough to have them, rarely keep up with inflation, so they decline in value over time. Earnings from work are much less likely to be an option at the age of 85. And even Social Security will have that bigger bite from Medicare taken out each year as those premiums go up faster than Social Security benefits. So one suggestion that people have made is simply ratchet up benefits, a pay increase for people over 85. A fourth idea that people have suggested, and this really draws on the intergenerational nature of Social Security, is to continue benefits for children of disabled or deceased workers if that child is attending school, either college or vocational school, to continue those benefits up to the age of 22. Social Security used to pay benefits to children up through age 22 in those circumstances. And as one looks today at the cost of higher education and the prospects for young families to support their children in higher education without the income of a parent because of death or disability, I think the cases it's time to revisit that question. Is that something that, a role that we want Social Security to again resume? Turning now to how might we pay for what we want? And I recognize that people in Washington don't like to talk about paying for what we want because it's about taxes. But after all, the business of Washington is to tax and to spend. And the business of Social Security is to remain fiscally responsible by both taxing and spending. So I think it's useful to at least think about some ideas for how one could pay for both the benefits that are promised under current law and any improvement that policymakers want to seriously consider. First, it's important to recognize Social Security does not need more money now, but policymakers could plan now for what's needed later. Among options to improve or to raise revenue are, first, to keep the estate tax, preserve it, and devote it to Social Security. Bob Ball, whom I think Mrs. Kennelly mentioned, has recommended that idea. It was also discussed by a pair of economists, Peter Orszag and Peter Diamond, in a book they wrote on Social Security a few years ago. I mean, one can develop a clear rationale for using that tax for that purpose. Another proposal is to gradually restore the tax cap, that $106,800 below which people pay Social Security taxes, to cover 90% of aggregate wages. That would cover about a third of the shortfall if it were done very, very gradually. If it were done more quickly, it would cover about half the shortfall.